everyone. This is Dr. Ruben Valdez of drvaldez.com and ihcmiami.com. Hope everything is awesome today. Today I'm going to be tackling another topic around pregnancy. In this specific episode, we're going to talk about women that are already pregnant, that have been previously diagnosed with a thyroid condition. And we all know that thyroid disorders can have a very negative impact on the pregnancy process and on the childbirth process. So I want to point out some things to look out for and some things that you could be doing on your own or together with your doctor to try and support your own health. Okay, so the first thing that we want to talk about is the entire thyroid cascade. Sadly, too many doctors only look at this top portion of that cascade, which is thyrotropin releasing hormone, TSH, T4 total, maybe sometimes T4 free, and then T3 uptake. There are many pieces of that cascade that are super critical to you knowing exactly where everything is, especially when we look at T3 total. It is dramatically important for a pregnant female that this T3 total be 110 or greater. One of the reasons why this happens and why this is important is because the developing fetus in the womb needs a lot of mom's T3. And here's why. We all know that DNA is kind of like the key to life. That's what creates cellular division, the production of proteins, structural proteins, hormones, enzymes, anything and everything that developing beautiful fetus, definitely going to be a lot more handsome than what I drew here, but they need a lot of T3 to stimulate their DNA synthesis, their DNA replication, their DNA translation, and just the full healthy development of this child. So T3 is a nuclear hormone. When there's enough of it to go around for both mom and baby, that baby has a much better chance at dividing and growing and becoming healthy and to be in optimal health. In addition to that, it's also very, very important to look at a set of markers that all tie into pituitary function. The hypothalamic pituitary axis is one of the most important endocrine portions of pregnancy and of birth. A few hormones that are very important to look at are FSH and LH. FSH stimulates the adrenals, LH stimulates the ovaries, and then TSH, which stimulates the thyroid gland together with prolactin. Many females that have the secondary form of hypothyroidism, what that means is that the gland is healthy, but there's things outside of the gland in the body, in the physiology, interfering with normal thyroid function. For many of them, they can experience pituitary dysregulation. And if the master gland is not doing its job during pregnancy, there is an increased risk for losing that baby. There is a lot of crosstalk between the thyroid gland and the adrenal glands. The adrenal gland is responsible for hormones like pregnenolone and DHEA, which are also super important hormones of pregnancy because they regulate the different changes that the fetus and the mom go through trimester to trimester. And lastly, females that have been diagnosed with the primary form of hypothyroidism, that is the autoimmune form called Hashimoto's, without a doubt, the most complex and the most prevalent amongst all forms of hypothyroidism. It is critically important to understand that pregnancy changes the immune system quite dramatically. 50% of that baby's DNA is mom's, and another 50% is actually dad's. So mom's immune system is going to start making antibodies against the proteins in the baby that belong to dad. Now, fortunately, those antibodies, those flags don't cross the placenta, so baby's safe. However, some of these antibodies could be harmful for mom, especially if there are other things firing up mom's immune system. So this is a really good period to have your food tested, test for food sensitivities, make sure that the stuff that you're eating isn't turning on your immune system. Super important period to do things like meditation, yoga, keep those cortisol surges, those stress hormones, keep them down and low as much as possible. Also, engage in moderate exercise. That can help in mild to moderate exercise can stimulate a hormone called BDNF, can really help with the baby's brain development as long as it's safe and low impact. Obviously, consult that with your doctor before starting. and try to eat as clean as you can, supplement properly with the guidance of your functional medicine practitioner. These are all things that can really help keep the immune system kind of restful and at bay to avoid the onset of a secondary autoimmune condition in those that already have a primary autoimmune condition. So there's a lot more on that. I think that I need to do a specific video about those triggers and things to avoid, but that's just to give you a general sense. If you are pregnant, these are a lot of the things that you want to kind of be aware of. Talk to them about your doctor, because they can have a dramatic impact on the outcome of your pregnancy. That is all. Thanks for tuning in. Follow us on our YouTube channel or visit us at drvaldez.com or ihcmiami.com. Bye.